been preparing since end of December, early January, when we sort of heard about this virus and the potential for it to spread. So the first thing that we did was we needed to try and get information on what the virus is and what the potential threats would be, and from there how it spreads, how contagious is it, so that we know what protective equipment to start purchasing and stockpiling. And so that's the personal protective equipment. We've got face masks, goggles, gloves, and the coverall suits as personal protective equipment. And then we've purchased high-level surface disinfectants and aircon treatment cleaners, so they disinfect the aircon and they disinfect the entire area in the ambulance. So if there are patients that we suspect have coronavirus, then as soon as we completed that case, we come to base, we use this to spray in the aircon, we let it settle for about 30 minutes. About half of that can goes in, and then after that, then we wipe everything down with this high-level surface disinfectant. We've got other very strong enzyme breaking chemicals as well that we use for blood and mucus and that sort of thing to just break that sort of stuff down. We've also put a proper policy in place with the staff so they know when to use the equipment, when to clean, how to clean, and that sort of thing. And then obviously just an info page for them on how to diagnose, what to be looking out for, how to stay healthy, how to stay safe. So surgical masks are to protect the patient from you infecting them with your own bacterias or viruses that you carry. Surgical masks aren't there to provide a barrier between you and an infectious agent coming in and inhaling that. So while they might create a barrier, they're not designed to specifically trap the particles of air that contain that virus. So the short answer is no, a surgical face mask is not actually the correct personal protective equipment that you should use. However, if you could double it up or triple it up, creating that barrier would reduce your chances of being infected. I don't think people need to panic at this stage. They definitely need to be concerned and be aware of the risks that are involved with this outbreak. However, coronavirus is a strain of the flu, and the people that are at risk should be more concerned than your general average citizens. So your elderly and your children and your immunocompromised patients and people with chest problems, respiratory problems, those are the ones that are at most risk of suffering a fatality. Otherwise, there's pretty good outcomes for people who are diagnosed early and stay healthy and were healthy before they got infected. So it's not to say that if you get coronavirus that you will die. And I think that's where the confusion and the panic comes from, is that everyone is thinking, I'm going to get this virus and I'm going to die. But that's not necessarily the case. And then also the World Health Organization and many other organizations are very actively pursuing a vaccine and proper treatment regimes, and that will definitely soon seem to sort out the concerns that we have. Yes, corona is associated with flu-like symptoms, so you'll have runny nose, you'll have a cough, you might have a sore throat, fever, feeling generally weak, which are all the same as the flu. So there's no way for you to really discern specifically whether you have corona or just the flu, which is why the important thing is education and awareness of this virus, and you knowing who you've been exposed to as well. So if you are going into large public places, then you must be aware that you may be at higher risk. Obviously, if you've been in contact with people from overseas, that would also make you at high risk. So if you then do pick up that you have a little cough or a sore throat or just feeling not well, then health-seeking behavior would be important. So you'd need to go to your GP or call an ambulance and rather get checked out than wait and see if it gets worse. Number one is be healthy. So make sure you get enough sleep, make sure that you're eating well, that you may be taking a supplement, possibly some immune boosters. And then from a hygiene perspective, it's very encouraged with the hand washing. Try and avoid shaking hands with people, try and avoid close contact with anyone out of your normal close family. And then it's the story of not trying to touch your face or your mouth unless you've washed your hands. Trying not to touch public places and surfaces that can be exposed, because the virus has been shown to sit for quite a while on a hard surface before it dies. So you can easily pick it up and then touch your mouth or your face or your eyes, and then you'll be infected. So those are my recommendations. You can see that we're busy preparing to supply all our branches with personal protective equipment for the coronavirus. We've got all our masks over here. We've got the disinfectant chemicals I've shown you earlier, masks, and then we've got all the different sizes of suits. So it's these white suits that we have with the hood. We pop them on. So there's various different sizes, boxes of these things, and then the aerosols to disinfect the air cons as well. So this is basically a pack of what we're going to be sending off to each branch. And it's got,
Is this specifically for the coronavirus?
this is specifically just for corona, yes. We've also got vitamin B co and thiamine as injections for immune boosters for our staff, just to keep them healthy as well.